Welcome to Vision for California, a web series of discussions on California's healthcare reform, hosted by Senator Dr. Ed Hernandez, Chair of the Senate Health Committee. Today's guest is Dr. Movsis Janbatian, President of the California Optometric Association.
Thank you for joining me today. We are going to be talking about the role that doctors of optometry play in healthcare here in the state of California. Dr. Janbatian, it's great to see you this afternoon, and it's a pleasure that you're here in the state capitol. I want you to tell me, well, first of all, congratulations on being elected as president of the California Optometric Association.
Thank you. I appreciate that.
Yeah. So tell me very quickly, when was the election? When did that take place?
It was in February. Usually it's a one-year term, and it is an exciting opportunity for a volunteer to be in charge of an association, a great association, that the primary purpose is to make sure there's proper eye care for the California residents.
So tell me just very quickly, your year as president, I'm sure you spent many years working your way up to become elected. What are your goals this year as president of the California Optometric Association?
Perhaps the biggest role I see myself playing is in making sure that patients have access to see their own doctor, and vice versa, the doctors have access to see their patients. There's a lot of play in the healthcare market to try to manage healthcare, and oftentimes HMOs become into the picture, and we are trying to make sure that patients are still able to see their preferred providers or doctors for their eye care.
Well, I know, and you know what an optometrist does, but tell me, tell the audience, what is the role of an optometrist? What does an optometrist do and a typical optometrist does when somebody comes in to have an eye exam?
Optometrists are, by most people, known as to provide vision care, and we go beyond that in a sense that not only do we check their ability to see clearly and provide them with either lenses or contact lenses to see clearly, we also check their eye health to make sure that eyes are functioning properly. And beyond that, we also check their health as far as in finding diseases in diabetes or hypertension or cholesterol issues or any other types of diseases that they may have, which they may not be aware of. Oftentimes people may have glaucoma or some other diseases that an eye examination will show. So we encourage them to be seen not only for glasses purposes, but for their eye health and body health in general.
Right. Well, following up exactly on the issues and that you say what an optometrist can do, what I'd like to spend a little time on is talking about exactly that, and more importantly, the role that our doctors of optometry can play with the inception of the Affordable Care Act, which is going to be taking effect in 2014. As you know, my biggest concern in the state of California is we have a huge workforce shortage.
Right.
And what's going to happen is right now we're barely meeting that demand. So the uninsured or the underinsured are not utilizing our healthcare system properly, and they're using it in the most expensive way they can, which is going through the emergency rooms. And even if right now with the healthcare providers we have, the physicians that is, the demand is barely being met. And 25% of those physicians are over the age of 60, so we're going to need to look at innovative ways of how we get healthcare providers to see those patients. And I envision doctors of optometry playing a critical role because of the training that we have and the optometrists have. I would like to talk a little bit about workforce and exactly what you had mentioned. Let's take diabetes, for example.
Yes.
As you know, there's epidemic levels of diabetes that are occurring in this country. Children have high levels of obesity. I want you to tell me, what is it that an optometrist does and how they can play a role with their primary care doctor in treating, managing, and dealing with diabetes?
You are right. Diabetes is probably, at least in my practice, seems to be a big issue. Oftentimes I'm seeing patients which they have not had a clue that they even had the disease, and when they come in for their eye examination, oftentimes greater than over 10 years, they're exposed, and all of a sudden they find out that they have oftentimes diabetes out of control.
Right.
Now, I think the doctors of optometry can play a crucial role in the sense that they can evaluate for those diseases, and as a screening, if we do find them in time or before they go out of control, we can play a crucial role in controlling them to make sure that the patient does not need a much more expensive and a prolonged evaluation or treatment, and if we can be able to take care of them and refer them to a proper physician ahead of time, I think we can play a crucial role in controlling the cost of healthcare, but more importantly, taking care of the patient's needs before they get to that level.
Well, let's expand on that a little bit more, because I agree with you. I remember numerous times where I've seen patients who come to me for the absolute first time in their life seeing a doctor, period.
Right.
And the only reason why they came into my office, and I'm sure you have a similar stories, is because they failed their DMV test. Sure enough, we do an eye exam, we take a history, we find out that they're thirsty, their vision fluctuates, and you and I both know those are the key symptoms of diabetes. We dilate their eyes, and we find out that they have changes in the back of their eye, which are endemic of diabetes. And you hit the nail on the head. What an optometrist can do, we can play a critical role in primary care, be part of the medical home, but more important, reducing healthcare costs by interacting with primary care physicians and being an integral part of the primary care health team. But let's talk about other diseases that I think a lot of individuals don't realize. High blood pressure, for example.
Absolutely.
Let's talk about that for a little bit.
Absolutely. Hypertension, along with cholesterol, they almost seem to go hand in hand oftentimes. Patients oftentimes are not aware of it, and when we do an examination and we do find instances or suspicion of hypertension, again, same way, we bring it to their patient's attention. And I think it's crucial to have them understand, not only from the patient's point of view, but I think the rest of the healthcare profession should also understand the crucial role that optometry plays and work with optometrists and vice versa to coordinate these benefits that we can provide to the patients.
Tell me some other things that I think the public doesn't really know. I'll give you an example, like brain tumors.
Right.
What is an optometrist, and how does an optometrist determine if a patient comes in, have no idea, no symptoms that they have a brain tumor?
Oftentimes, when they come in, just again, trying to, because they can't see far away, the DMV test, or if they're 40 or above, they can't read the phone anymore, or can't read well enough anymore. They come in just to get reading glasses. And as you mentioned earlier, we do a comprehensive examination, not only to check their vision, but to check their eye pressure, to check the eye health, and part of it is the dilation to check the back of the eye. And oftentimes, I have found situations, and many of us do, that we find signs of a particular type of tumor that we see in the back of the eye that the patient has not had any indications or symptoms of yet. And if we do find that ahead of time, again, to treat those kind of situations before they become out of control and too late, it's a big advantage for the patient, I think, and again, for the cost of treating that patient.
And you had mentioned, we'd already talked about diabetes, high blood pressure, common tumors. Let's talk about a disease that's becoming very common, especially in communities of color, like amongst the African American and Latino community. I'm sure you know we're talking about is glaucoma.
Glaucoma, exactly.
And as you know, doctors of optometry, you can treat glaucoma. How are we going to play an integral part in healthcare, making sure that we can continue to do that?
I think perhaps the best thing we can do is educate the patient to make them know that optometrists can, in fact, detect those kind of diseases. It's not that we only provide the eyeglasses per se, but when they do come in, they are being checked for and evaluated for any one of those diseases. And I think it's our job also to let them know that we are doing those things, just to inform them that not only they can see well with what we're going to give them, but we have checked, in fact, for their pressures or for their tumors or for their diabetes, hypertension, and all that. And hopefully that information will disseminate through the rest of their community as to, we didn't come in to get a pair of glasses that they liked, but we checked everything else. I think there's a disconnect right now between the healthcare community and what optometrists can do. And unfortunately, many physicians do not utilize the expertise and the profession of optometry for the benefit of their patients.
Okay. I'd like to spend a little time talking about, unfortunately, the state budget, how difficult it is, and the budget cuts we've been making. Last year, as you know, we dealt with the reimbursement rates to providers, also the co-pays to the patients, because we have such a tough budget situation. But I'm assuming that most people don't realize that it's doctors of optometry in high numbers that do accept Medi-Cal reimbursement to see Medi-Cal patients.
Correct.
Which I really believe is an important part because there's so much cost shifting. Tell me your concern if the state budget continues to look at reducing reimbursement rates for providers and the impact that we're going to have on the most neediest population in the state.
It is a concern in our profession because we do see many Medi-Cal patients, and as a matter of fact, I believe in every county in the states, optometrists see Medi-Cal patients. And as probably a lot of the audience knows, the medical reimbursement rates are not in par with many of the other reimbursement rates that we get from Medicare or some other insurance companies. And we do understand that it is a budgetary issue, but I think unfortunately it's coming to a point where further reduction is going to place many providers in a position where whether it makes sense for them business-wise to continue to see Medi-Cal patients. Right. Because it does, we do have to run our offices, we do have to pay for staff, for rent, and if we are seeing patients with reduced reimbursement rates, somehow we have to start thinking whether it makes sense for us or not. And there's a danger of that at this point, I believe.
And I agree, but fortunately, I still believe that optometry as a profession feels strongly that this is a population that needs to be seen.
Absolutely.
And the care needs to be given, even if you're getting reduced reimbursement rates.
Absolutely.
There is going to be some relief when PPACA or the ACA comes into effect. 2014 Medi-Cal reimbursement rates will be 100% of Medicare, at least for a couple years, so it'll be helpful. But I think that's a very important issue that we need to address, not only doctors of optometry, but all health professionals, to make sure that they continue to see those patients. But anyway, I wanted to thank you for joining me here in the Capitol. Again, congratulations on being elected president of the California Optometric Association. I know it's quite an honor because I had that honor in the year 2000 when I was president and past president now. So with that, I'd like to thank you, and I'd like to thank you for joining us. It's been a pleasure.
Today's production of Vision for California with Senator Ed Hernandez featured special guest Dr. Movses Janbatian, the president of the California Optometric Association. We invite you to check back for upcoming segments. Thank you for watching. See you next time.